Good morning and welcome to Community Conversations. It's a beautiful fall day and I'm glad you could make it here today. My name is Cathy Jordan and I am the chair for the Elmhurst Senior Commission. And what we try to do is to provide educational information for older adults and caretakers or for whoever needs that information. Today, before we start, I'd like to thank our commissioners. They really work very hard. I always say you're only as good as the people that you are working with. We have Grayson Haller, we have Jackie Haddad downstairs, Chris Hansen. I see Maureen Wood in the background there. So, I'd like to give them a round of applause because they work very hard to come up with these programs for you. And Cathy Lorenz just walked in the door, but and we'd also like to thank Mayor Morley and the council because without their support, we would not be able to present these presentations for you. Today, I have something kind of interesting to share with you. We put in the flyer that Sue Davidson would be here today. And on Monday, she called me and told me that there was a death in the family and that she would not be able to attend. And she apologized, but said that, she was very nice, but it was like, good luck. I was in a pickle. I thought, okay, what are we going to do? Because this is such an important subject. Medicare is so difficult to navigate through, and I just feel that, when my husband and myself reached that point, we needed that expertise. We needed someone who knew what they were talking about, so I thought, oh no, I don't want to cancel this. Who do I call? And I need to share with you, the SHIP representatives are very far and few between around our area. At the end of the day, I ended up calling down to Springfield and talked to the director of SHIP. And God love her, she came here today. She drove all the way from Springfield to make sure that this presentation would be possible and to share all that important information with you today. So I want to tell you a little bit about that lady, and I'm very grateful. That's all I can say because the last thing I wanted to do was cancel this. I'd like to introduce Sandy Leith. She is the director of the Senior Health Insurance Program, which is SHIP, which is part of the Illinois Department on Aging. Sandy is responsible for a team of over 1,000 certified counselors who assist people with Medicare and their caregivers in 250 offices throughout the state of Illinois. She has been with the SHIP program for 19 years and has worked with Medicare and insurance for 25 years. Sandy has a bachelor's degree in management from the University of Illinois in Springfield, is married, and has 2 children and a new granddaughter, Lucy Jane. Sandy enjoys working with Medicare and finds it more like a hobby than a career. She says, it is great to do the job you love every day. Obviously, she must love it. She came up here from Springfield. Her alarm didn't go off. She had to get dressed in the washroom and put on her makeup. She is like a guardian angel, so I'm just so happy to introduce Sandy.
Oh, but there's shopping up here, so it's not all bad. Got off the toll road and I saw Outlet Mall. All right. So, but I am thrilled to be here with you today and thrilled that this is being taped for cable TV as well. So, it helps because this is a busy time of year, isn't it? Again, my name is Sandy, and Sandra D to be exact. If it's hard to remember, I was named after Sandra D. Guess what my sister's name is? Brenda Lee. I'm not kidding. Now, I can't say this to a group of younger people because all they think of Sandra D is Grease and Sandra D and Danny, right? But people who know Sandra D and Brenda Lee, the singers, realize what Mom and Dad were up to. So I'm glad to be here. I'm part of SHIP. SHIP is part of me, I guess. We're all one and the same. I've done it forever. It's Senior Health Insurance Program. Has anyone used SHIP services before? Sat down with a counselor? Well, you're doing it today then. Let's start something new. How many of you think Medicare is fun and a hobby like I do? I heard some gasp. I heard you say, what? What kind of crazy woman is this? But it is. It's something that it changes all the time, and I learn something new every day. So that is the type of job that doesn't make you, you're not bored doing that kind of job. So today you have PowerPoint in front of you. We've got slides up on in back of me. And so you can follow along. What I did was I put 2 slides per page, save a little paper, and if you want to make notes on that, fine. And again, we will take the questions afterwards. I was told to kind of focus on Medicare Advantage versus Medicare Supplement plans, and that is the hardest concept to get. How do you receive your Medicare? Original Medicare with a supplement, or take it all through something else, which would be called Medicare Advantage. Are there people in here, by a show of hands, that have Medicare Advantage plans or Part C? Okay, we have a few. Okay. So hopefully I'll make that clear for us. And then we're going to talk about, obviously, Part D. How many of you are dealing with Part D enrollment right now? Trying to figure out, okay. All right, so let's dive right in. The Medicare Basics. This is, unfortunately, I really thought I was going to have the 2016 deductibles and copayments here for you today. They have not released those yet. I'm sure you've read stuff in the paper. Oh, your Part B is going to cost a lot next year. Have you seen some of the press releases? That is why it's taking so long. They're trying to figure a way to make it less of an impact on the users, on the people on Medicare, and not so expensive for everyone. So I think we're winning that battle in that the copayments and the premiums aren't going to skyrocket, but we have to wait and see how this all pans out. So I thought they were going to be released yesterday, and they did not get those out yet. So hopefully any day soon. In fact, when I get those, I can send the flyers to the township, and they can have them here at City Hall for you. So I will promise to do that. Let me see if my clicker works. Okay. SHIP is a senior health insurance program. It's been out since 1988, but we were housed in a different place. There is a SHIP in every state and all 3 territories for the United States. It's Medicare grant money. It's actually Medicare. We're their eyes and ears. We're out there teaching people and sitting down one-on-one in local communities, giving people help, okay? Helping them with their Medicare choices, which over the years have become quite a chore. It's free counseling. It's sponsored by local organizations, such as a township could sponsor us, a senior center, a lot of the area agency on aging offices sponsorship, and even hospitals. I started SHIP at a hospital in the Springfield area, so I was with SHIP in a healthcare setting, and that's how I fell in love with Medicare and all of that. So they're volunteers, and there's over 1,000 of them. Most of them, I would say about 75%, are paid staff that work at senior centers and do this kind of thing. But there's 25%, maybe 25 to 30% that, they're retired and they just want to get back into things, and they're busy volunteers. So if anybody thinks this is your match, by golly, I'll help you out with that, and we'll put you through training. We certify people for SHIP. It's a 4-day training. You learn the A, B's, and C's of Medicare, and then it's continual training because, obviously, Medicare is continually changing. So eligibility for Medicare, I'm just going to glaze over. This is on your next page. People are 65 normally, right, when they go on to Medicare. Or I can be somebody with disabled on Social Security. I can be someone disabled. I've seen 7-year-olds on Medicare. Someone with end-stage renal disease, kidney failure, or ESRD could indeed be on Medicare. They are fast-tracked into Medicare in our health system because Medicare is a single-payer type system, and it is a way to take care of people, make sure they have insurance. People with ALS, or Lou Gehrig's disease, they're fast-tracked in because of the disease itself, because of the outcomes with the disease, and that it doesn't take too long for it to take a person down. Fast-tracked into Medicare. Just a little guideline, you have to be a citizen, or if you're not, to get Medicare, you have to be lawfully admitted and lived here continuously 5 years. So someone cannot just move here and sign up for Medicare. Those folks would be paying for Medicare, and it's very costly, but they can't even take it until a lawfully admitted person lived in the United States for 5 years continuously, not 6 months here and 6 months elsewhere, continuously, 5 years. So that's just a little sidebar on Medicare. 2 different ways to get Medicare, and the slide shows you my little puzzles. I always like to use this because it is a puzzle. This, I'm talking about the 50-year-old original or traditional, whatever you want to call it, Medicare. You have your red, white, and blue Medicare card. It tells you what your Medicare number is. That is someone's social security number with a letter behind it or in front of it, so guard it with your life. That is a number that is very, very sacred as far as not getting that in anyone else's hands. That will be changing. That is slated under federal government laws to change to get our social security numbers off of that card. A little more safe. In this day and age, it would be a good thing. But anyway, I'm talking about traditional Medicare. Original A and B. A is hospital. B is medical. That's part of the top of the puzzle, but that no way takes care of all your insurance. I also put in another puzzle piece that says Medicare Supplement or secondary. Does anyone have a retirement policy that followed them into Medicare? Okay. So you retired from somewhere and you have insurance that will help with your Medicare gaps. That's wonderful. Federal retirees, state retirees, those are your big groups on retirement, but also many companies have retirement insurance. So they would have that or a supplement policy. They would buy a Medigap or a Medicare supplement. Have you heard the terms Medigap or Medicare supplement? They drive people crazy because it's the same thing. Medigap is a policy, a medical policy that pays the gaps. Medicare supplement is just the legal name, the insurance savvy language for a supplement that is going to tie into Medicare's puzzle pieces and pay the balances for most things, if not all. And we'll talk about that in a little bit. And then ever since 2006, and oh my, did my life change then. In 2006, we had Part D, so we had to bring a whole nother piece of the puzzle, and that is your drug benefit. Think of that as just a little piece of Medicare that you can buy, or you don't have to buy it. You really don't. Now, those with retiree insurance, do you probably have drug coverage through your retirement? So you don't need that piece of the puzzle. So it depends on what you have and your personal situation. All the more reason to sit down with a SHIP counselor or call us over the phone. We do have an 800 number that is on all of your materials here. We'll make sure you know where that is before I leave today. But that is the puzzle. That's original Medicare. What does original Medicare do? It allows me to go all over the country, anywhere I want, to a doctor or hospital or any provider of medical services that takes the Medicare dollar, that actually takes Medicare. If they take Medicare, then that's wonderful. I can go anywhere, show them my card. It's very portable. So those of you who are what we call snowbirds or like to live elsewhere for several months of the year, might be a good option to just stay with traditional Medicare, okay? Now, little bitty sidebars on Medicare. The Part A costs. Part A, again, is our hospitalization. How did we get Part A? A lot of you are getting it for no cost because you have paid for it with your FICA taxes, your employment taxes. How do you pay for it? You work 10 years. Or my spouse works 10 years. Or even a divorced spouse had worked 10 years and hooked me in. As long as I was married to them for 10 years, I can get Medicare through them. I have an aunt that is she's been a school teacher for 44 years. She's retired now. Some school teachers never paid in back when she started work. They never paid in. They paid into their own system, their own retirement system. So she was ineligible for Medicare when she retired, I'd say about 4 or 5 years ago. She came to me and said, what do I do now? Do I just stay on my work policy? I said, yeah, you can, but what about Uncle Junior? Does he have Medicare? He had a job the whole time, right? You were married to him. You are allowed premium-free Medicare Part A. She was blown away. I thought Aunt Palma knew everything, but she didn't know that. She taught for 44 years, but I got to teach the teacher something. That was nice. But really, if they can hook to it, Social Security will find it. They will find some link and say, okay, you can get Medicare through this relationship. So that's our premium-free Medicare Part A. If somebody were to buy it, it's over $400 a month. So if I came in, did not pay into the system, set up residency, and I want to buy it, it's an expensive product, okay? Also, Part B is something that we pay for as well. So we're going to go to Part B next. Part B is medical. Part B is everything outpatient. If you're not lying in a hospital bed as an admitted patient or lying in a skilled nursing facility as someone getting a rehab stay, then you are in Part B if you're using medical services. B is everything. B is your ambulance. B is your MRIs, your outpatient hospital, your emergency room visits, and every time you go to any doctor that takes Medicare, that is B. Every anesthesiologist, radiologist, certified nurse anesthetist, can I say that right? Everyone who is not room and board in a facility would pretty much be Part B. So Part A is our room and board in a facility. Part A also pays a little hospice. Hospice is if I'm terminally ill, have less than 6 months to live, I elect hospice. It's just a piece of A. B is everything else. Now, people can say, oh, I don't want Part B. Oh, I don't think I'll take that. Why would you not want it? It is, it's got a $147 deductible, which you'll see on the slide, and it's $104.90 a month. So for less than $105, it's major medical insurance. It pays about, in rough terms, it pays about 80/20. It has a deductible. It's not a huge deductible. In 2015, it's $147. Okay, we'll find out what the 2016 is very soon. But I can elect not to take that. Now, why would I? Maybe I turn 65 and I'm still working. And I'm working for the state or the federal government or a really nice employer plan that I like. And if I'm still working and that employer plan has over 20 employees, by law, Medicare is not going to be first anyway. Your employer plan is. So if you have anyone looking at, do I take B or not? Do I take that Part B and start being charged $104.90? I've met a lot of working people still on their health insurance that are trying to take Part B, that they're still paying for Part B. I've met a lot of people who are throwing $105 out the window when they do that. So it depends on your employer plan, and you need a personal conversation on that. Now, there is a resource I want to tell you. If someone is working and thinking they shouldn't take Part B, there's a great publication on the internet under Medicare.gov, Medicare.gov, and it's called My Guide to Health Insurance, Who Pays First? So it's like who is on first, who's on second for my situation, and there's all kinds of situations. So I often talk to people, plants are closing, jobs, layoffs with jobs, whatever. I often talk to people about that and who's going to be on first, who's going to be on second for them. But let's just say we're retired. I have Medicare A. I take Medicare B. I have comprehensive hospital and medical insurance. That's how it works. That's how the puzzle works. B pays about 80% after that deductible is met, and that deductible comes around every January 1. So it's an annual deductible. You don't write a check out for $147, but when you go out to the doctor on January 1, January 2, anywhere in the beginning of the year, your first episode of a doctor visit, that deductible will be taken out of your payment at that time. So then you'll end up paying that to the doctor. So once that's out of the way, Medicare pays 80%, you pay 20%. Just kind of simplifying it, that's how it works. I'll get into a little more detail on that in just a second. So when I say 80-20, then somebody's got to pick up the 20. Somebody's got to pick up the deductibles. A lot of people buy what we call a Medicare supplement. So I'm going to spend a little bit of time on our supplements just because they are a big thing. It seems like that's a big thing up here where you have original Medicare and a supplement. I always say a supplement is you pay it and forget it. That means you've got Medicare, you've got Medigap or Medicare supplement, and everything's paid up pretty much. So what you've got here in your handouts is a standardized policy, and the good thing about Medicare supplements, it's an insurance product. It's regulated by the state of Illinois Department of Insurance. They're guaranteed for life. Once I buy a supplement, I don't care how sick I am or how healthy I am, they cannot charge me more or less. They have to charge everybody in my class the same premium. Now, it will, most of them, go up as I age. They can do that, but they will write that language in your policy. But they will not cancel my policy just because I got cancer or just because I was in the hospital. They cannot do that. They're guaranteed renewable for life. As long as you pay the premiums, guaranteed renewable for life. Back in the day, before 1992, there were 250 different types of Medicare supplements out there. And someone would walk in and say, I want to talk to you about supplements. Could you imagine the sales pitch for that? I couldn't imagine trying to sell that insurance nor sign up for it. I came into working with Medicare after 1992 when they were set in little silos. You can buy a supplement plan A, a B, a C, a D. They were 10 or 12 little silos, and I want to show you that on the next slide. That is at the bottom. You've got the Medicare supplement chart. They are labeled A, B, C, F, G, K, L, M, and N. Now, we do know our alphabet in Medicare, and the reason we're missing a few letters is there used to be policies with these names, with the D plans and the E plans, but the E plan has gone away. There used to be a J, and it has gone away. Modernized, if you will. So as we've modernized this scale, some plans have been taken off the market. Now, what if I had a plan E and it's gone? What did I say? They were guaranteed renewable for life. So people can still continue. So there are still people with those old policies out there. Doesn't mean they're bad policies, but they're guaranteed for life. So people buying them today, this is the schedule, A through N, and you can see there's check marks in some boxes or check marks in all boxes. I'll give you an example. A Plan A says all it's going to pay is core benefits. What are core benefits? Core benefits is every time I go to the hospital or every time I go to the doctor, every Part B service, doctors, hospital, outpatient, equipment like wheelchairs, breathing machines, when Medicare pays that 80%, a core benefit sup policy, med sup policy, will pay the 20%. So, okay, cool, that's paying the gaps. But that's about all it's going to pay. It won't pay the deductible if I'm admitted to the hospital. It won't pay my Part B deductible every January 1. So I need to find a policy in the other scheme of things if I want those paid for. It doesn't pay for skilled nursing facility copayments. So the farther I go on the scale, the more benefits I get. And when I get about halfway through the scale, there's a Plan F. It's a very marketable Plan F. It's very comprehensive. It's the middle of the road, but it's the go-to. When you pay a Plan F premium, a lot of times you'll pay nothing else under Medicare. It pays all your deductibles, all your copays. So you'll see that being a very popular plan. You can buy a Plan F regular. You can buy a high deductible Plan F to save a little on premiums if you're very healthy and you think, I'm not going to use this insurance, but I want to have it. There are a lot of variations. Another go-to publication I need to tell you is there is a 95-page, literally, Medicare Supplement Premium Comparison Guide done by the state of Illinois, by SHIP. We just finished it. It is on the website at Illinois, let me think about this, www.illinois.gov, and you would put /SHIP, S-H-I-P. www.aging.illinois.gov. I have to get my agency in there. I'm with the Department on Aging. Aging.illinois.gov, tells you it's a government, and then a /SHIP, S-H-I-P. Slash is like a hash mark going forward. Yes? www. Yes, www.aging.illinois, spell out the word Illinois, .gov, G-O-V for government, and then a /, it looks like a hash mark, and then S-H-I-P. And then you'll see a tab on the Department on Aging's website. On the very right, you'll see a SHIP tab. You click on that, and it will tell you everything about us. We have a home page, and we have tons of publications out there. Actually, there's webinars out there also. So if you didn't get enough of me today, go see what I looked like 5 years ago. I'm still out there on some old webinars. They're old, but they're still good and they're valid. So a Medigap or a Medicare supplement policy is something that you really get into and you stay in a lot of times. And here's the thing a lot of people think. They think we're in open enrollment right now for Medicare, correct? You've heard this. You've seen all the commercials. It's open enrollment. When it comes to MedSups, Medigap policies, these private insurance policies, has nothing to do with open enrollment. Absolutely nothing. These are private insurance. This is like buying car insurance or fire insurance for my house, whatever. It's an insurance product. It doesn't have anything to do with the government-sponsored Medicare annual enrollment period that we're in right now, which is October 15th through December 7th of every calendar year. If I want a Medicare supplement, when I come on to Medicare Part B, that's the time I need to go hook up with a Medicare supplement plan. There's a thing called open enrollment to a Medicare supplement. That starts the day I take Part B and goes 6 months forward. No one can turn me down. So let's say you retire, and boy, your health is really bad all of a sudden. That's probably why you retired. You're on Medicare, you need a supplement, and you're thinking, no one's going to take me. I tell you what, it's open enrollment. From the first day you take Part B of Medicare, 6 months forward, no company selling Medigaps or MedSups can turn you down. This is open enrollment for Medigap. So that's a wonderful thing. So people get into a plan, but it's not something that you're going to change every year. You can try to change, but what these companies will do, depending on how they like to underwrite your health conditions, they may take you or they may deny you later on. So a lot of people get in a plan and hang out with that plan for quite a while. Some people find, I need to move over later, but if their health is decent, and they can find a company that will take their business, then they do that. So these are very different from how do I receive my Medicare? Do I switch from traditional to something else? How do I do my Part D next year? That's different. That's open enrollment, which is right now. Medigap is an insurance policy. Totally different rules. That's why I talked about that Medicare Supplement Premium Comparison Guide. It has about 13 pages of nothing but text telling you about Medicare supplements, the best read you're going to find. And it's about 20 years in the making, so we've got it down to a science. Okay, so that's Medicare supplements or Medigap. Moving on, because we need to. We've got Medicare Timelines. I just threw in a little bit about enrollment changes. Medicare in general, how do you want to receive your Medicare? Which Part D drug plan do you want? There are timelines. There are restrictions. Some people are locked into their decision for the year. That's why we have this open enrollment period. We're picking what we want for January 1 of 2016. We stay with it for the year. So I put in there, you can't always sign up exactly when you want to. And Medicare does have specific enrollment periods. Things like maybe if you move from Florida to Illinois, you'll have what we call a special enrollment period. If you didn't take Part B on time, and now it's 5 years later, and you say, I need to take Part B, you might have to wait to what we call a general enrollment period. Every January 1, everyone can go down to Social Security and sign up. You can't just join Medicare B anytime you wish. So there are different periods, and of course right now we're in open enrollment. So now I'm going to get back to our Medicare puzzle. This is the second half of the puzzle. This is showing Medicare Advantage. Now, I see commercials all over, especially when I travel near the Chicagoland area. I see a lot of commercials. There's a lot more products in a more populated area. This is taking your Medicare and privatizing it. This is a private company selling A and B of Medicare. They can't not anybody can do it. They've been approved by the government to do so, but they're selling a different type of Medicare. Things like HMOs, PPOs, have you heard of those on the news or on any of the ads? So it takes your Medicare, your medical, your inpatient, your outpatient, A and B, it takes your Part D, and it pulls it all into one thing. Do you need a supplement? You cannot have a supplement with these. No one can have a supplement. This is all one-stop shop. Okay, and I'm going to talk a little bit more about those, and then we'll pull that puzzle back together. Part C is what it's called, or Medicare Advantage. And we love our acronyms, so MA, Medicare Advantage. So in your slide, it says Part C is just another way to get your Medicare. And it is. It's a privatized way. We've actually privatized it through private companies. So in this land of the United States, we have traditional Medicare or Medicare Advantage Medicare. How do you want it? You decide that during open enrollment. You can switch back and forth to either side of the puzzle. Things like HMOs is listed here. HMOs have a network. Okay, it's Medicare with a twist, a little attitude, if you will. A little bit of choice is gone. You need to go to the doctor, you have to get a referral from your HMO. You will have a primary care physician tell you where and when you can have this test or that test, and kind of corral and manage your care. Watch all the lab results. Don't duplicate doing lab work again and again when we can all keep it together and watch it. If you're going to go to a specialist, I'll pass those lab results over to the specialist. If they need additional labs, then yes, the specialist goes on and does labs, passes them on to the next specialist. Managing the care. You've heard it maybe called managed care, but it's really Part C of Medicare. Part C is A and B squished together with some drug coverage. It's all one thing. Don't need a med sup. PPO is another type of Medicare, private Medicare. It will allow you to go in the network and out of the network. So maybe I am a snowbird. Maybe I do live somewhere for 3 months out of the year. I can take a PPO and go in and out of network. When you go out of network, a lot of times you're going to pay more copays. But it gives you choice. And then a special needs plan is a very specific, it's like an HMO, and it's called a SNP, Special Needs Plan, SNP. And what it does is it takes care of our dually eligibles, our Medicare, Medicaid, so our very low income, and it takes care of our very chronic care. So you may have in your area, looks like an HMO, but it's called a Special Needs Plan or a SNP, and it will take care of people like the health. If they have chronic diabetes, chronic renal disease, something like that, the plan would be covering that along with social services and just be an all-comprehensive, better way to manage somebody's care with a chronic disease. So there are 3 different ways there. That's the primary ways that you can receive Medicare other than traditional Medicare. So let's look at the puzzle together. So I brought all the pieces in, right? So original Medicare on the left, A and B, Med Sup, or some kind of retirement policy, pick up some drug coverage, got it. I can go anywhere I want in the land that takes Medicare. On the right, Medicare Advantage, HMOs, PPOs for the most part, have a network, Medicare with a little bit of a twist, a little more rules and regulations. If people don't like somebody telling them where they need to go for their health care and when they need to go, they shouldn't be in one of these plans. Had one this week that called me and said, Mom is stage 4 cancer. We don't want to mess with the network. It's in open enrollment. We want to get her in the right place for January 1. I said, what do you want? And they wanted a supplement and original Medicare. That's what they did. So they were able, even with cancer in place, to find a Medicare supplement that would take her, though. And there are a few companies that will guarantee taking just about anyone. So that was her choice. During open enrollment, she really switched from one side of the street to the next. Okay, so that is our insurance. That's our basic. Oh, one other thing I wanted to say, I'm going to back up to that. With both of those, you know how I said you pay $104.90 for Part B premium? With both of those, you will still pay that. You don't get away from paying $104.90 for Part B. Whether you take it through a private company or have it through original Medicare, you're still going to pay the Part B premium to the federal government. Okay, so that is a common question I get all the time. Remember, on Medicare Advantage, you cannot have a supplement policy. It's all included. With the Advantage plans, and I didn't mention this, when I have an HMO or a PPO, I pay premium to the plan, and they're usually cheaper than a supplement. I have a network to deal with, right? Everybody's charged the same premium. Everybody's charged what we call copays. So when you go to the doctor, you might pay $5 for your primary doc every time you go. If that doc sends you to a specialist, you might pay $35 or $40 for a specialist. So this is very different from traditional Medicare, which is an 80%, 20%. This is, if you use it, then you've got copayments. I call them user fees. If you use it, you will start paying. So if you're very healthy, it can be a very cheap way to go with your Medicare as well, very inexpensive. If I'm very healthy, I may want to take this. Believe it or not, some of these Medicare Advantage plans charge nothing. No additional premium other than you're paying the government $104.90. How can they do that, right? They're actually paid by the government a pot of money for every person in every month. They get a pot of money for every person in that HMO or PPO. So if that person gets sick and starts needing services, it's the company that has to pay for it out of their pot of money that they're getting from Medicare. They're not doing it for free, but they're not charging any additional premium. You can see where some low-income people that don't quite get Medicaid help, they might take this because it's a good option for them. Cheaper coverage, but they have the doctor network that they need. So there's a lot to the choices. I think that's why SHIP is so popular, that we can have you sit down or talk to us on the phone and we make sense of some of this stuff. If you really want to try something different, let us talk to you about it. Okay, so I'm going to get into what's happening right now. Open enrollment. Medicare's open enrollment, October 15th through December 7th every year. We're making the change. We're making the switch for when I wake up on January 1. Or maybe I do nothing. If you do nothing in this period and you like your Part D plan, your drug plan, if that plan's still there, hasn't sent you a letter saying we're leaving, then it probably has sent you a letter saying, here's what you can expect next year. Here's what we're going to cost. Here's what your drugs are going to cost that we currently see you're on. Those are called annual change notices, or ANOC, annual notice of change. They've sent a letter to everybody, and if you don't want to do anything, you just wake up January 1 and everything rolls over. However, if you do want to check and see what else is out there, maybe you're on some new medicines from last year, you might save money by just checking. It says Part D is coverage by, again, this is private Medicare. These are privatized plans. There are 28 different plans in Illinois that sell, or different, should I say, policies. It might not be that many companies, but it's 28 different policies, drug policies, that I can look into. So here I am. I've got a drug list. I know what I take. I know where I want to buy my drugs. I know what pharmacy. Now I need to know, out of those 28 policies, what's the best deal for me? What is the cheapest? Who's got the least deductible? Who pays all my drugs? Who doesn't cover my drugs? Maybe some of those plans don't cover everything I'm on. I don't need that plan then. I better not take that plan, because if it's not covered by that company, I pay out of pocket. So you want a drug plan that covers everything. I'm going to take you to your next slide. In 2016, I do have the numbers, actually, for Part D. That has been released. The national average premium for a drug plan in 2016 is $34.10. But that's a national average. In Illinois, we have one that's $18.70, and we have some over $100 a month. So, wow, what a difference for drug coverage, right? Wow. But those plans are very different. And the only way you're going to know is to run your drug list through that plan finder, which I'll tell you about that in a minute, and find out what the best bet is for you. Plans are also rated on quality. Oh, sorry, I'm going to stay up here on this one. $360 is the deductible for 2016. So it's gone up a little bit between 15 and 16. And then if somebody is taking a lot of prescription drugs and they get into what we call the coverage gap, or you might know it as when it first came out, it was the donut hole. If they take a lot of prescription drugs, they might get into this coverage gap. Well, we're closing that coverage gap. By law, by the Affordable Health Care Act, we're closing that. So we're about, it's 45%. If you happen to be getting a brand name drug and you're in the coverage gap, you will pay 45% of your drug costs, not 100%. And if it's a generic, you're going to pay 58%. So it's about 50-50 if we want to round it all up. You're not paying the full cost if you fall into the coverage gap. You're paying about half. By 2020, you will pay 25%. So it'll be like drug coverage will be 75-25 for the most part. So we're trying to squeeze that gap, because when it first came out, that coverage gap was, I'm paying premium, I jump into the coverage gap, and I pay everything for the next few months until I get out of that coverage gap. When do I get out of the coverage gap? When I have spent out of pocket, last one on that slide, $4,850. That's my out of pocket. That's all my co-payments. That's a lot of prescriptions. Those are my co-payments or percentages on my drugs I'm taking. But if I go that far, and I've seen people who go through that, folks, in 1 month. We had a lady call last week, $18,000 a month in drugs. So they're going to blow through this in no time. They've spent their out-of-pocket, boom, and they're in what we call catastrophic Medicare Part D. What does it do? For the rest of the calendar year, it's going to pay 95% of that person's drug coverages, and they're only going to pay 5%. So if you get that far and you're truly on those prescriptions that way, you're really going to have some good coverage. For $18.70 or $100 a month, whatever you're paying for your drug plan, really, not bad. So I've seen a lot of the good But I've also heard the stories, why do I take a drug plan? I don't take a drug. That's when we say, find the cheapest one in the land. It's only a certificate that you're going to buy for 12 months. Don't feel loyal to anybody. It's a 12-month drug plan. You can switch next year. Nobody's going to care. Okay? Medicare cares about this. It's called quality, big time. We're moving into quality. So when you go out on the web, on the internet, and look at some drug plans, it will have quality ratings. They're rated a 1 through 5. In the state of Illinois, 5 being the best. In the state of Illinois, we do not have a 5-star plan. I think the closest gets to a 4.5. Plans that are low premium or low scores are actually 3 stars or less. If they do that for more than 3 years in a row and have a quality rating so low, Medicare actually sends letters to their members and says, you're on a low-performing plan. Would you like to get out? They actually say that. That's my words, but that's exactly what the letters is telling them. And they call us on our SHIP hotline and say, why do I want to get out? We say to them, do you like the plan? Are you happy? Stay if you want. But if you're not, if you're one of the many who have filed a complaint against that plan because of one thing or another, it could be customer service, it could be how they pay their claims, it could be just how they're treated when they try to call, or lack of answering the phone. Last year I had counselors in January trying to call the plans about some information that was wrong, and it took 8 hours on hold. That particular plan is no longer selling this year. So that is some of the power that we have. We can call 1-800-Medicare. Did you know you just dial 1-800-Medicare, spell it out on the phone, 1-800-Medicare 24 hours a day, except for Christmas and Thanksgiving. You can call Medicare and complain about what's happening. They will take an official complaint on a plan. Why? Because these quality ratings is where it's at. That's how the government is regulating them, or one of the means, besides audits and such. And we want to play with big players. I have relatives in North Dakota. I went to do their Medicare.gov plan finder on my in-laws. I found out, hey, North Dakota has a 5-star plan. That's wonderful. What Medicare does for those guys is that if you're a 5-star plan, you can take members all year long. So you can actually go to somebody who's on a 2.5-star plan or a 3-star plan, and if they say, I really don't want to be in this plan anymore, you can sign them up, even in the off-season, because you're a 5-star plan. So this year, for 2016, we have no 5 stars, but I do want to stress quality ratings could be your deciding factor. If 2 plans are very similar, look at the quality rating. That might be the way to go. We're also at Medicare doing a lot of quality ratings on hospitals, doctors. You will see quality ratings on everything before it's all said and done. Home health care, nursing homes, everything. Okay, so we were talking about Part D. Now we're talking about if someone is of lower income and they can't pay for Part D, those copayments are even too much for them, they could file for what is called extra help. Extra help is when 2006 came along and Part D came along, the federal government said, we're going to put in extra help. It's a subsidy program for Part D. It will take those copayments. If it's a $40 copayment on a brand name drug, it will shrink it down. It will shrink down the premium. There are certain plans you pay absolutely nothing for if you have extra help. Now, this is run by Social Security, and it has been since day one. It started with a big paper application, and now it's really an online application. And people that get extra help, it's wonderful. I mean, because I see a lot of people out there that are living off of $1,200, $1,000, $800 and some dollars a month. They would get extra help and get their plan paid for and their co-payments down to hardly nothing. So anyone gets into these areas, you do need to make sure they get to someone who can help them with extra help for Medicare. So I've got a few slides on that just for you to take away, but I won't go through all of them because you can read that, and also Social Security website is wonderful. The application is actually right on Social Security's website. Very easy to do, but Social Security is going to want to know, where are you on the poverty level scale? 150% of the federal poverty level or lower, which gives you the guidelines here. If you're a single family or single person, $1,471. For a couple, $1,991. Anyone anywhere near that should probably check in with extra help. They're also going to look at the money you've got in the bank, though. They want to know not only what your income is, but how much in resources. 13,640 in cashable stocks, bonds, annuities, all of that. Income. Not income, but savings. And then 27,250 for a couple. So we've got the chart here. The application will ask you everything. And then they will also cross-match it with Social Security. If you're found eligible for extra help, you'll get a letter from Social Security. It will tell you you're getting extra help. And we will tell your drug plan this, and the drug plan will then calculate lower copays, sometimes no premium, and away you go. So extra help is a best, I'm not sure if it's a best kept secret, but it is something people do need to apply for. Now, our very lowest of income, people that are right at 100% of poverty level and are always on Medicaid, Medicaid and Medicare do talk to each other, and they will automatically hook people up with this extra help benefit. So it is an automatic. The other thing I wanted to put in here was if you qualify for extra help, what it'll also do is get you some coverage under Medicaid. We have some other programs under Medicaid that might help people. So if they're low income and cannot afford a supplement plan, maybe they need to have Medicaid helping them with the Medigap stuff, the copayments, the deductibles. So I wanted to put some information not only on extra help, but on Medicaid products as well. And your copayments are then the next slide. If I am in an institution and I'm low income, if I'm getting community-based services, if Department on Aging has community care program, has anyone heard of that? Someone comes to the senior's home and does housekeeping and a light duty housekeeping and cooking and grocery store and that kind of thing. It's actually a Medicaid program that brings people to your home to help you, keeps you in your home. People with that program actually pay zero copayments for drugs, and then it goes on from there with your different copayments. So it is a good way to save lots of dollars if you can't afford it. And there is the chart. I took that out of your slides. It's quite a large chart, but it'll tell you. Actually, I didn't, did I? Look on page 12, and you do have this Medicare Savings Programs income and guidelines. So if anyone is anywhere near that, you need to be talking to SHIP and make sure we get you to a site to do an application. A lot of times it's online. They can do that really quickly. Okay. Okay. So we talked about how you receive Medicare, which side of the puzzle you want to take it from, your Medigaps, the HMOs, PPOs, the Part D, the subsidy portion of Part D, how to get help with your Part D. Now let's just talk about general marketing to wrap this up. Unsolicited beneficiary contact. Now I'm talking about, we're in Medicare annual open enrollment right now. So that is for drug plans, and that is for Medicare Advantage plans like HMOs and PPOs. I cannot be contacted if it's unsolicited I can't get an email from a plan, anything in writing, via an email to my inbox. Hey, do you want to buy such and such drug plan? Not allowed. Door-to-door solicitation, not allowed. Not allowed at all. Calls after attending a sales event, unless I said and signed a card, please call me about your products, okay? And I did put a note, it does not apply to Medicare supplements because insurance agents, brokers could call you about a supplement. But when it comes to Part D and Medicare Advantage plans, no cold calling. Also, cross-selling, no cross-selling. Don't get in, if someone does invite a person selling a plan into their home and they try to cross-sell a life insurance policy at the same time, not allowed. Absolutely against federal regulations. And then there's one thing called a scope of appointment flyer. There's actually a form that has to be filled out 48 hours before an insurance person would meet with a person in the home. They'd have to have the scope of appointment form. It actually says what exactly they're going to talk about. If they're going to talk about life insurance, that should be another appointment. So it's very specific. And you can read these in their entirety. But marketing and healthcare settings, we had a little trouble with that. Where do Part D people wanting to sign people up, where do they go to market? They can go in cafeterias, recreational rooms, conference rooms, as long as Medicare said they can be there. They have to have their outreach completely signed up through Medicare and approved. But they cannot be in waiting rooms, outside of pharmacy counters. We had a lot of problems with that. Exam rooms. So someone comes out of the doctor and then, boom, you're there to sell them a plan. Not allowed. Okay? And then just basic things to ask yourself about when you're joining a plan. What coverage do I have? Talk to a SHIP counselor. Joining a drug plan, there's some steps here to joining a Medicare Part D drug plan. If I want to go to the Medicare Part D plan finder, I need to have my drug list. I need to know exactly, are you on a blood pressure medicine, cholesterol medicine, how many milligrams, how many times a day do you take that? Where do you want to go? Do you want to go to Walgreens, Walmart, CVS? What pharmacy? Do you want to go to the mom and pop down the street? You can tell the Medicare plan finder exactly all of this information. In fact, you need to tell it all of this information. Pick exactly what you want to do, where you want to get your drugs, and then you would be on what we call the Medicare plan finder. This is a picture or a shot of the site. This is at medicare.gov. Medicare.gov, that site is amazing. You're going to personalize your search if you want, or just put your zip code in. So give me just general for my zip code, or here's me, here's my Medicare number, here's when I joined, here's my zip code, and it will actually pull you up and say, oh, hi Sandy, you have this Medicare right now, you get extra help. It actually knows you. Anyone can do this. If you can't do it, get a 13-year-old at Thanksgiving, because they'll be able to do it on your computer, and have them sign on to Medicare.gov. But it walks you through putting in your drugs, and then when you get to the results, look them over, decide and join. So it's going to tell you, okay, Sandy, you have 28 drug plans here. Let's say 10 of them cover all of your drugs. The other 15 don't. Well, I'm not touching that then. Okay, go back up to the 10. It'll calculate the deductible, the co-payments, all the math for me, tell me the best out of pocket for me. It'll say this will be $500 for the year out of pocket, and this one's $510, and this one's $1,000, and it'll just keep going. It'll also say if you go to this pharmacy, it'll cost you this much, but you can choose to this mom and pop down the street that you've chosen, and it'll cost you this much. Or you can hit a button and say mail order, and it'll tell you exactly. It's amazing. It'll tell you exactly what mail order will cost. No, I don't know who invented this, but it's amazing. That's what SHIP counselors do, thousands of those every year. Again, you can try it out. Also, 1-800-MEDICARE will do those with you. You can call them up at 2 in the morning if you happen to be awake. Let's run my drug plan finder. How about? Medicare.gov will do that for you. Okay? Here's the 1-800-MEDICARE information. They are closed on Thanksgiving and Christmas Day, but they're open on New Year's. Why? Because open enrollment just ended. We're all waking up in our new plans, and we need Medicare to be on the line if I need a drug on the first day of the year. Call volumes are busiest during 10 to 4 on weekdays. So if you want to call them up in the middle of the night, they're there for you. Just in open enrollment, they take over 4 million calls. They send a lot of calls to me at SHIP at the Illinois Department on Aging. So if somebody really needs to sit down with a counselor, they will then flip that call to my helpline. Illinois will say, okay, let's find someone in Elmhurst, Illinois to help you. Let's find someone in Chicago to help you. So open enrollment is a very busy time. Our offices are getting busy and filling up. There's other resources here, such as Medicare and Social Security for the extra help. And I think, wow, this could take days to explain, but we've done it in about an hour. So, thank you. This has been Medicare.
Another round of applause for Sandy. We really appreciate her. And I'm going to give her some flowers from coming from Springfield. Thank you so much. Thank you so much. Thank you all for coming. One of the things I'd like to share with you before we close is today you probably when you came in received our Pocket Pal. This is something that the Education Committee works on, and it's about the 3rd edition that we have. They are resources for you to either carry in your purse or in your pocket. And it's just helpful to know when you need help, you can just refer to this guide. The Education Committee and our commission, we really try to make sure that you're educated before a crisis happens, because anytime you're in a crisis mode, you make wrong decisions. So, make sure you take the Pocket Pal. You'll also be receiving it through the mail. So if you have one and you know someone who hasn't got one, please pass it along. It would be very nice. Community conversations will be coming back again in the springtime. We appreciate you coming, and I always close with a little quote, and I probably cannot see it without my reading glasses on. So, if you want to feel rich, count all the gifts you have that money cannot buy. Have a good day. Thank you for coming.
Hi, I'm John Quigley, President and CEO of the Elmhurst Chamber of Commerce and Industry. In these challenging economic times, it's imperative that our residents and businesses band together to not only shop Elmhurst, but buy Elmhurst whenever possible. We have great stores in our city center, Spring Road, Butterfield Road, York and Villette Streets, St. Charles and Route 83, North Avenue and Lake Street, along North York and even Grand Avenue. I ask for your help. Let's keep our tax dollars in Elmhurst.